Chapter 23, Nursing in a Culture of Violence. The learning objective for this PowerPoint is recognize the incidence of violence within the family, in the community, and in the workplace. Challenges and opportunities. Some of the challenges to identify and intervene when providing care for a victim of violence. Detection requires a high level of skill in communication and assessment, but this is an opportunity to have a positive impact on client outcomes. Family and violence includes child abuse, elder abuse, abuse of male partners, violence between same-sex partners, intimate partner violence, which is defined by the CDC as the intentional, emotional, and/or physical abuse by a spouse, ex-spouse, boyfriend, girlfriend, ex-boyfriend, ex-girlfriend, or date. Domestic violence includes physical and emotional abuse. It occurs in all strata of society. Traits include over-possessiveness, excessive jealousy, desire to control or dominate, poor control of impulses, low tolerance for frustration, belief that physical measures are necessary to control children, dependence on an elder for financial support, drug or alcohol abuse, history of poor mental health or personality disorder, and history of abuse as a child by own parents. Intimate partner abuse is usually men against women. That's the most common. Historically, societal acceptance regarding violence against women by husbands was okay. Some cultures have a greater acceptance of abuse than others. The categories of abuse include physical abuse, sexual abuse, psychosocial abuse, and property violence. Physical abuse is any physical harm or non-consensual touching. Sexual abuse is forced or non-consensual sex. Psychosocial abuse includes threats of harm, abuse of pets, or constant criticism. Property violence can be threatened or actual destruction of material possessions. Abuse victims often find it difficult to leave the abusive relationship. Sometimes there are 3 to 5 separations before finally ending the relationship. Social and culture's beliefs may play a role in the person staying with the abuser. Sometimes the abuse victim self-sacrifices for the good of others, and they feel responsible to keep the family together at all costs. They may be loyal and feel that they're a duty to stay. Sometimes there's financial dependency where the person feels they cannot leave because of money. Belief that abuse ends with divorce, but separation in many cases brings increased level of harassment and violence, leading to homicide. Domestic violence on children. If you are a witness of domestic violence that violates the child safe haven law, victims may suffer from abuse from parents, siblings, a boyfriend, girlfriend, or babysitter. Laws mandate reporting. Physical abuse is defined as a non-accidental injury. Most common types of abuse include burns, bruises, fractures, abdominal injuries, head and spinal injuries, and also there's shaken baby syndrome. That's when the baby's shaken and harm is caused by the shaking. Physical neglect is failure to meet the basic needs of children by those responsible for doing so. Physical neglect may include neglect of nourishment, clothing, housing, supervision, or medical care. Sexual abuse is any sexual activity between an adult and a child. Emotional abuse is failure to provide an environment in which the child can thrive, learn, and develop. Elder abuse is for those who can no longer live independently and are vulnerable. The likely perpetrators include family, non-family caregivers, or professional caregivers. It's currently defined by state laws. There's a National Center on Elder Abuse, and they define 3 categories of elder abuse. They are domestic elder abuse, which is by a person who has a special relationship with the elder. The second one is institutional elder abuse, which is at a residential or nursing home or long-term care facility, and self-neglect, which is failure to provide sufficiently for himself or herself. Types of elderly abuse include physical abuse, inappropriate use of drugs, physical restraints, force feeding, sexual abuse, emotional and psychological abuse, abandonment, neglect, financial exploitation are all examples. Violence in the community. Children are at risk for developing psychological problems if they are abused, depending on the frequency, severity, and if it's chronic in nature. They will also develop psychological problems depending on the child's characteristics and the quality of family and social relations. School violence has increased, and there's an increased concern with school shootings and bullying in schools. Risk factors include hyperactivity, low academic performance, peer delinquency, and availability of drugs. Violence in the workplace, it can be in the form of physical assault, homicide, threats, and verbal abuse. The cost of violence in the workplace includes loss of productivity, work disruptions, employee turnover, litigation and legal costs. In the United States, healthcare workers, especially nurses, are at a greater risk than other service workers. The United States Occupational Safety and Health Administration, which is OSHA, provides prevention guidelines. They include management's commitment and employee involvement, worksite analysis, hazard prevention and control, and safety and health training. So, assessing the effects of abuse, we need to ensure privacy. The victim must feel safe from perpetrator, and we need to express a genuine desire to help. So physical assessment should include, to observe for signs of abuse, should include assessment of the head, skin, musculoskeletal system, the abdomen, and the neurological system. Planning and implementing includes the goals of treating abuse include empowering the client to take control and provide support to the client. Short-term interventions, because of the short contact the nurse usually has with the patient, is to determine immediacy of danger, convey to the person that they are not to be blamed, and they have a right to be safe. You can explore options for help and provide information of available services. In your chapter 23, table 23-1, there's a screening and intervention triage for abuse. A triage structure should include screening, intervening, and documenting. You need to become familiar with agency protocols and resources. There are national organizations for abuse victims. In order to help prevent abuse, there needs to be early screening. You need to explore your own feelings and values regarding abuse, and there also has to be a comprehensive violence prevention program. Terrorism and weapons of mass destruction is a major challenge worldwide. Terrorism is defined as politically motivated violence or threat of violence. In 1998, there was an establishment of the Office for Domestic Preparedness. It provides training and emergency responder guidelines. Weapons of mass destruction categories include nuclear weapons, radioactive, biological, and chemical. Strengthening the public system, Metropolitan Medical Response System program provided funds for communities to develop plans. There's 23 essential capabilities of the communities program. Essential response capabilities to incidents are listed. Please refer to the box on page 438 in your textbook.